So good morning, everybody. So welcome to the orientation for the Office of Interprofessional Collaboration IPE activity that's scheduled for Friday, September 13th, 2024. And it's a fun session we've done many times before. It's on role clarification and negotiation using simulation. Next slide, please, Laura. So starting off with the traditional land acknowledgement. In the context of collaboration, I always like to think about when we do the land acknowledgement and how important it is to collaborate not only with each other as healthcare providers and our clients and their families, but also with communities. That reconciliation happens at a community level, not just at an individual level. And so what can we do as healthcare providers as we move forward, making sure that we understand the truths, the ongoing harms of reconciliation and the past, the colonization, how we can figure out for ourselves how we can help move reconciliation forward, both individually and collectively. And so I call on us as clinicians, administrators, educators, and researchers to recognize the traditional Indigenous territories on which we find ourselves, that we pay respect to First Nations, Métis, and Inuit ancestors, and confirm our commitment to respectful relationships with one another, the land, the water, and all living beings. Next slide, please, Laura. So we've been undergoing some changes in interprofessional education for interprofessional collaboration across the Rady faculty, but we've been in this business since 2016 in this formal iteration of the Office of Interprofessional Collaboration. Certainly IPE has been going on in the University of Manitoba for many years before that. But in our current place, we have the 5 colleges, they're listed on the slide, and 10 programs who in varying ways participate in varying IPE activities or interprofessional education activities. One thing that all the activities that we host or help facilitate that they have in common is that we have grounded our curriculum in the collaboration framework from the Canadian Interprofessional Health Collaborative in 2024. And they identify 6 collaboration domains or competencies. Next slide, Laura. So the framework looks a little bit new. This was released just this year. You can see the framework on the left. You will notice if you dig into this that there are 2 different frameworks. One is a little bit more simplified and one's a little bit more detailed with some definitions. This is the simplified version. It's also available en français for those who are interested. So the new nomenclature for the framework are listed on your slide here. Relationship-focused care and services, that replaced patient, family, client, and community-centered care. There was great national discussion about really what is important is the relationships. Team communication and team functioning, 2 and 3, these are in no particular order. Previously, they were referred to as interprofessional communication and interprofessional functioning. There's certainly been a huge emphasis nationally and internationally to think about the people who do not self-identify as professionals who are part of the healthcare team. And so this is certainly intentional that we're moving towards team-based care as opposed to interprofessional care. The 4th one listed their role clarification. Previously, it was only role clarification. Now the and negotiation was added to it in the new version, recognizing that it's not just about clarifying whose role it is to do what activities as part of the team, but that sometimes you have to negotiate who's the right provider at the right time. Collaborative leadership, that has stayed the same. Team differences, disagreements, processing, that replaced interprofessional conflict resolution. The new nomenclature it takes a little bit to get your tongue used to wrapping your head around this, but it's an acknowledgement that not all differences or disagreements are necessarily conflict, and that really the importance is about processing these differences. In the new framework, they acknowledge it's about the task, the process, and relationships or between people that needs to be processed to be acknowledged. And so in this new framework, there's as I pointed out at the bottom of the slides, there's less focus on the professional, but everybody is part of the team. The contextual factors in the background of the image, there was always about quality assurance and the context, but now they've included in the contextual factors complexity around systems. Sometimes we can try as hard as we wish to work as a team, but the complexity of the system sometimes dominates how and when we can actually collaborate as a team. So that includes electronics, for example, virtual care. And in the bottom left-hand corner, they use the initials are in the order of inclusion, accessibility, and equity. And so the new framework is also acknowledging that we need to address all these areas that potentially impact teamwork. Next slide, please, Laura. And so why do we do this? This is part of the introduction that we do with the learners, certainly from the Institute for Health Improvement in the United States. They originally in 2007 came up with the triple aim, why we're trying to actually improve the entire system. But as over time, it became the quadruple aim, the quintuple aim, and the sextuple aim. And so in all of this, it includes, the patient experience, the environment, lowering costs. The quadruple aim was about the clinician well-being. The quintuple aim added health equity to the equation. And the sextuple aim, most recently, was very much about being stewards of the land and the environment. But overall, we do all of this with the goal of improving better health for everyone, and at the same time being able to improve the economy. Next slide. So we're going to just dive right into some of the logistics, and then we'll talk about the actual session. Next Friday, we don't have all programs participating from the Rady faculty, but you can see here, we have dental hygiene, dentistry, pharmacy, physiotherapy, medicine, midwifery, and physician assistant. So 7 different programs are participating, and that adds up to about 305 students. So it's still a good hunk of people. And all these learners this year are in the second year of their program. We have formed new teams for next Friday's event. There'll be 35 teams. Some of the students might know each other, but the majority of the learners will not know each other. They've been randomly assigned. However, we paid attention to make sure that every team has somebody from oral health. And then we've distributed as much as we can everybody else. And certainly the different classes have different sizes. So not every team has one of everybody. So the physician assistant and midwifery program, for example, they have fewer than 35 students. So not every team has a midwife or a physician assistant student. Medicine has the greatest class size. So every team has 2 or 3 medical students in it. One thing that's different, rather than having all the materials waiting for you in your assigned classroom, we decided to have you come and pick up your materials and then drop them off at the end again. It also gives you a chance to connect with us if there's any last minute questions. And we'd be distributed across 7 rooms. So we do not have 35 facilitators. We are using the large rooms, and each of us will be facilitating multiple groups at the same time. That's a little bit different too. Next slide, please. So here, everybody's on Bannatyne campus. You can see the room number on the far left. Apotex, the top 2 are in the pharmacy building. Theater E is at the end of the hall from the College of Rehab Sciences. And then those 4 rooms that start with an R are all in the College of Rehab Sciences. You can see that we tried to take the big load off by having 8 and 6 groups in our larger rooms. And then Sandra, Becky, Tanya, and Tanya Walsh, you've got a smaller number of groups. Where we have the large groups are like 8 teams and 6 teams. We've doubled up as facilitators. So together we'll figure out how we're going to move around the room and who might take the lead. So Jillian, you and myself are doing one room together. We'll figure out who speaks to which parts as we go through. So we need to connect a little bit. We've done this in the past where we've had 2 or 3 facilitators for a large room full of small groups. It works out quite well. In an ideal world, maybe we would have everybody in a small room with 1 facilitator. But on the other hand, it's maybe not the best utilization of our limited resources either. And making sure that we don't burn out all our facilitators. We have 4 IPE activities before the end of October. So we want to make sure that that we keep everybody enthusiastic as we move through this. Next slide. And so this is an outline of the activity for the afternoon. For the first 10 minutes, there'll be an introduction and an icebreaker. We have a facilitator guide ready for you, and it was attached actually to today's invitation, and it was only put there yesterday, so you may not have noticed it. But if you go to today's meeting invitation, it's attached there. It's an 8-page document with extra resources, and it has a number of icebreaker activities that you can pick from. You only need to do one. but different facilitators like different icebreakers. So we're giving you the autonomy to decide for yourself which icebreaker you like to do. And you can do the same icebreaker for all the groups in your room. Then we move into a mind mapping activity, which we're going to give you the details about. Then 20 minutes to prepare for the simulation activity, where our learners and teams will meet our fictional case of Alex Parker. We'll give you the details about that as we proceed here. We have a 10-minute break scheduled in. If you're running behind at that point, you can always take a few minutes from the break time if you need to, although it's always a nice chance for students to go to the bathroom. Then for 15 minutes, you actually meet, your teams will meet Alex Parker. And there's one standardized client for every team. So we have 35 standardized clients meeting their teams, playing the part of Alex Parker. Then there's an opportunity for a debrief for 15 minutes, 15 to 20 minutes. Part of that is with the standardized client who plays Alex Parker, some without. We're going to go through that this morning. Then there's time for wrap up and evaluation. 15 minutes is perhaps a little bit more than you need, so you might be able to make up some time there. And we have an optional facilitator debrief if you feel like that's where you'll return your materials, and we'll have a chance to hear how it went. Next slide, please. The learning objectives are for this session. They provide, it's certainly following pedagogical best practices. The first part is referring to the context. So while focusing on enabling teamwork for patient safety, learners will be able to explore communication tools to better team function, to ensure the patient, client, family, community voice. An opportunity to ask about professional practice competencies, roles, and responsibilities among the different team members, and to share responsibility in creating positive outcomes. Those are learning objectives. The simulation, or the entire session is based on simulation. I will say that some of the students have done or used simulation before in their learning, some have not. So for some of the learners, they've never used simulation. This is a brand new sort of activity for them. So we're trying to help set the stage for them as well, what simulation entails. So the simulation really next Friday is about a team meeting and meeting our fictional patient or case. Laura, over to you.
So in terms of showtime, when we're actually engaging and inviting our learners to put on their hats to engage with the patient, we've kind of broken it down into scene 1, scene 2, scene 3 to have some fun with movie sets. So in terms of scene 1, so you'll all already be in the room. The patient will be, as Moni mentioned, waiting for us to invite them into the room, and we will have prompted them and met with them prior so that they are also stage ready. So after the introduction and the icebreakers in scene 1, the team is doing a purposeful discussion on clarifying concepts of person-centeredness, and that's that mind mapping activity. So really, they're just sort of getting into the mindset around just sharing their different perspectives within their roles and responsibilities as they understand them at this time, being in year 2 of their program, which could be halfway through their program for some, and towards the beginning of the second half of their program for others. So it's really about just looking for similarities and different viewpoints on what is meant by the concept of person-centered care. So really getting into that space, talking about values and assumptions, those sorts of things. In scene 2, they are preparing to meet Alex. So that's where there's 20 minutes to actually look at the script that has been provided. It's a very short script that they have. They don't have the full details that the standardized client has, nor that you will have, but just the little script, and sort of begin to prepare on how they will meet Alex, applying those key points. I'm just going to grab my pointer here. Grabbing some of those key points, those values, those assumptions, those skills that they've been talking about when they were more generically discussing person-centered care. So staying grounded in person-centered care. The whole intent of the session is about role clarification and managing and working through team differences, not conflict, but differences, different perspectives, different views, and very, very much less on the actual clinical situation that Alex is presenting with. So we are focused on interprofessional collaboration for better health and health outcomes, but really around those skills, around clarification of roles and team differences. So they're preparing for that. So a good 20 minutes in mind. They might choose to use their mind map and extend that discussion. So they stay grounded in what they have discussed earlier around values, assumptions, and skills. So they might start afresh. We will have in the room materials like either they can use the whiteboards, we'll have whiteboard pens, or we'll have, if there's no whiteboards in the room or not enough whiteboard space, we will have great big Post-it notes that they can use. We are very mindful of our environment and trying to move away from paper and those sorts of things, but we need to catch up resource-wise. Then there'll be a break, and then the actor actually will come in the room, and we will welcome patient into the room. They'll sit with their team that they've been assigned to, and then the team will simulate the patient interview that they've prepared back in scene 2, and then debrief with a wrap-up. And again, as Moni mentioned, a facilitator debrief. So that's the Showtime script you can have in your back pocket. The ground rules here are, I think, very familiar to us all now. Sorry, I'm on the wrong slide here. Which slide do you have? Do you have the September 13th welcome and introduction?
Yes.
Okay,
Yep.
thank you. I was reading my speaker notes here. So on September 13th, we'll have the welcome and the introduction. We'll pick up materials by 2:30. Moni mentioned the attendance sheet. In the folder in the package will be the attendance sheet with a QR code. And you will put that on every table, or every team will have their QR code. You will invite people at that time to share their name and their program, or within their team alone. And then again, as Moni mentioned, name ideas for icebreakers. So share one stereotype about your profession and how that stereotype makes you feel. You may feel comfortable doing that. You may not. You might just want to keep it more simpler, something you're curious about regarding teamwork. Morning beverage of choice and why. Another one, something you did unique. And then this one I've done many times, and it's kind of fun. Do you prefer to be in, on, or beside a large body of water? And then people kind of explain sort of why their choice is, to be in the water rather than beside the water. Okay. So ground rules: be open and fair-minded, integrity and humility, right? So these are very common ground rules about engaging in this space. Recognize, acknowledge, no blame, trust, integrity, with respect and individual experience, share the air, recognizing you're not experts, and asking for help. So in this case, we really are focusing on the interprofessional education description, that it's about learning with, from, and about each other for a reason, for better healthcare. So we're looking for differing viewpoints. It really is not a debate. You're just really engaging in discussion. And one thing as well that we like to think about, that, when you share your opinion or your thoughts or your ideas, that you are sharing that, and not to assume that it's the absolute truth for everyone. So scene 1, simulation activity. The team discusses the person-centered care and team functioning, and aimed at enhancing patient safety and quality. So this is the mind mapping activity. So we've given them a bit of a script here around what that mind mapping scenario is. So this is where they're thinking about it. So they are a team working at a local access center. The staff wish to enhance their teamwork to better patient experience, worker experience, system efficiencies and outcomes, while addressing health equity. So that returns them to the quintuple aim. And it is about them in a team meeting, like we all experience team meetings. So no patients present at this time. They're just having a team meeting. The team decides they need a better understanding of how each individual healthcare provider approaches person-centered care from the lens of their own profession. So that's that role clarification and relationship-centered care. Without this understanding, it can sometimes lead to disagreement, role confusion, and overlap between the team members. So that's the team differences and disagreement processing. In fact, it may be the reason that some patients complain that they're asked the same questions by different teams. Team members and patients might say, don't you guys ever talk to each other? So that therein is the team communication. So when you're with the learners and introducing this team mind mapping activity, you're preparing them and getting them into that set, right? That this is what's happening during this mind mapping activity. And to the best of your ability, if you can help the learner really immerse themselves in that setting rather than this being an academic exercise, right? We want them to get into that role play, that they are a team and that they are going to be meeting with a patient shortly, and they are having this sort of team meeting to emphasize where the values, the assumptions, the skills that they're hoping to be able to deliver. So the team collectively agrees, that's the collaborative leadership, to spend some time doing a team building exercise, the team functioning activity, and share their professional and personal approaches to interview a person presenting in their practice, their concerns, their goals, relevant history, and living situation. All right, so next slide. So the mind mapping would look something like this. They can use the whiteboard, they can use the big Post-it notes, but they're beginning to throw some ideas out there in terms of commonality and diverse meaning or understanding of the needs. It could look like this. There's no actual way to do a mind map, or there's a variety of ways of doing a mind map. And so maybe they're using a Venn diagram kind of concept, or it could be something as simple as this. We circulate as facilitators around the room just to help them make sure maybe they don't quite understand this concept of a mind map, make sure they're on track with that. But really, you can, as you're circulating around the room, you can sort of, if you see something that you'd like to add, certainly you can suggest that or have them ask, have they considered this? And, you know, maybe, you know, as good facilitation, keeping things open, questions, sort of, can you explain that further? You know, this is an interesting point over here. I wonder if there's other things you might consider, that sort of thing. So we do have in our facilitator guides some extra prompts. So when you're doing this mind map or helping the students do the mind mapping activity, the facilitator guide will be there handy for you if you yourself need a little bit of prompting. So simulation activity 2. Michelle, are you doing this one or am I?
Yeah.
Okay.
Thank
Sorry,
you.
I'm being off because my dog is in the bit. I'm going to get the toy away from her. She's busy with it.
So for scene 2, we're continuing on the simulation activity. This part is also 20 minutes. And this is where the students and their teams will prepare to meet Alex Parker. And as Laura had mentioned, they may or may not build on their mind map ideas, or they might start fresh in this part. Next slide, please. Thank you. So this is the fictional case of Alex Parker, and the students will have received this part of the case beforehand. So they will have read this, so it won't be new information for them. And then you as facilitators will also receive the script of Alex Parker. So you will have what the standardized clients have received as their script. So I'll just read the case here. So a fictional case of Alex Parker. You're working in an interprofessional primary healthcare clinic. Your preceptor or supervisor has asked your team to go and meet Alex Parker and take a history. Vital signs are respiratory rate 20, heart rate 78, blood pressure 150/90, oxygen saturation of 95% on room air, temperature is 36.5 degrees Celsius. Alex has requested this appointment because of a persistent cough, fatigue, and bad breath. You are not to do a physical assessment. And it is important that some of these students may have never experienced a simulation activity before, so reminding the students to treat Alex Parker as a real-life person seeking care and be mindful and respectful throughout the whole interaction and communication. Next slide, please. So while the students are preparing to meet Alex Parker, some of the facilitator prompts to get the conversation going that you might use would be that the students can start building on their mind mapping activity. So what do you want to ask Alex? Who will ask the questions and get the students to explain why? Decide on 2 to 3 students to take the lead from different professions. Decide on who will be the timekeeper, note takers, and observers. And there will also be an observer simulation team debrief form that will be provided to you in your facilitator package that you will pick up beforehand, that you can give the observers in the teams beforehand so they can take notes on it. And then before they actually, the third scene, when they actually meet Alex Parker, the students will be provided with a 5 to 10 minute break. And at this point, you as facilitators can go greet Alex Parker. The standardized clients will be waiting out in the hall, and you'll be able to show them their pre-assigned tables. I don't think we've quite figured out if we're going to do numbers or how we are going to identify it, but it really doesn't matter which team that Alex Parker goes to.
So one thing that we could add to that is that you might, depending how many groups are in your room, you might want to have that number of empty chairs sitting out in the hallway. So when Alex Parker arrives, they have somewhere to sit while they're waiting. I did that last year. And when I found my Alex Parkers out in the hall, they were all having their own conversation and verifying what they were going to be, their characters, if you will. And so it gives them a chance to connect as well. And so during the break, you have a chance to go out in the hall, introduce yourself, see if Alex Parker has any questions. And if you've not done this before, Alex Parker might appear as a man or a woman. The students could ask what pronouns they prefer, but we have 35 Alex Parkers, so we did not specify whether Alex Parker needed to be a man or a woman. Alex Parker so shows up with, you saw the STEM that the learners will get. But so Alex Parker has some concerns, and just, you will see the script, but like last year, Alex Parker is a retired teacher from up north, smokes a little ganja, drinks a little bit, has moved down to Winnipeg to pursue a relationship. And so then they move the interview from there. So this is scene 3 is the actual simulation activity. So now there was the break. You brought Alex Parker into the room. You might also want an extra chair at each of the tables or the rows where the student groups are meeting, so that there's somewhere very clear for Alex Parker to sit. And the teams could decide in advance where they want Alex to sit. Where do they want the chair? So that they don't, they can decide how they best would set up their chairs to meet with Alex Parker. So the team meets with Alex Parker for 15 minutes. And they have 15 minutes to ask the interview questions. So this is actually a simulation. We're aiming that this activity should start at 4 p.m. at the halfway mark. Alex should only, as a standardized client who's been trained, they should only respond to the questions that they're asked. So they shouldn't volunteer how much they smoke unless they're asked, for example. If the team is shy, the standardized clients have been prompted to prompt the teams a little bit, but they're supposed to wait until they get asked a question. As we've mentioned twice already, you will be provided with the detailed script of Alex, so you know what to expect, but the learners, of course, don't have those details. Learners are permitted to take a time out and ask one another for help, but they really should be taking the entire 15 minutes. If a team is done in 10 minutes, there's a problem. Then they haven't taken a thorough history. And again, some of the students have actually had clinical placements or exposure to practice setting already. Some have not. So this is an opportunity for learners to learn with, from, and about each other, and to teach each other how to actually take a history potentially if they've never taken one before. Next slide.
Next slide. I just want to emphasize too, this is not a test. Like, this is not a simulation where the students are being evaluated or assessed on their ability to engage with Alex. So that we just have to let go of that thought, because some of us might be really experienced in that scenario. But this is just for them to have that initial, very safe space to really explore what it feels like to interact. Again, we've mentioned it maybe for the first time, a patient or a client. So That's why we really want to emphasize that we are giving them 15 minutes. And really, we know when we're with a client, we can explore and wouldn't we all love to have 15 minutes in this space with a client? So really taking that opportunity to use it and to emphasize with the students that they can, do that timeout or tap out. So let's say if 1 or 2, 3 students have said they've been identified by the team that they will ask the questions, they can time out and tap out and say, can someone else step in now and let me watch you? That it can be that fluid.
One thing, I'll say that we've given Alex some required things to say. So for example, if the team doesn't introduce themselves or what professional program they're from, the standardized client is supposed to say, sorry, who are you? Like, introduce yourselves. So those kinds of basic interview skills are certainly here. And hopefully, usually our learners have that already under their belt. Next slide. So yes, use the full 15 minutes. So then we know that in simulation, where the learning takes place is really in the debrief. So there's about 20 minutes total in this, partly with Alex, the standardized client, and partly without. So the standardized clients have been given specific guidelines on how they're to give feedback to the team. Sometimes they are way too kind and don't give really much feedback at all. Other times we have had some standardized clients who they've never been harsh, but sometimes they go into great detail. So every standardized client is a little bit different, it's true. But they are supposed to provide feedback, not on the questions that were asked, but on how they worked, how they communicated together as a team with the patient, making Alex Parker feel like they're part of the actual conversation. That's really what the feedback is geared towards. And so then Alex Parker, after 5 or 10 minutes, when Alex Parker is done, they're invited to leave. And the standardized clients in your room, they can go home. That's it. We don't need to talk to them anymore. So they should be done by, for sure, by 4:30, that they're out of the room. And then actually sooner than that, I can't remember the timing. If it was 4:15, 4:20, 4:25, 4:20, 4:25, they should be leaving. Then the team continues debriefing without Alex, and they have another 10 to 15 minutes for this. The team observers, the team had decided who was the observer. They had that simulation team debrief form. There was some things for them to look for. Everything was based on the collaboration competencies, the 6 competencies. So to give them a framework of what they're giving each other feedback on, how they did in A, B, or C, and team communication and team functioning. So the team observers lead the debrief. Again, there's no facilitator at every table, so they need to do this themselves. Next slide. I think it's back to you, Laura.
Yeah. So in helping them with the debrief, again, maybe some of them have never experienced a debrief, just spend a few minutes just talking to them what a debrief is. So emphasizing that, this is where the learning reflection really occurs, and to encourage those courageous conversations, team differences, or I wonder how we could have handled that differently, those sorts of things. Let them, just so that they know that this is still the learning activity. The observer is going to, the 1 or 2 people that have been keeping notes during the interaction with Alex, they can lead the team debrief because they've got the notes. But at the same time, the whole entire team should be engaging in that debrief, and not just the observer sharing what they observe, but really engaging in those courageous conversations. If there's time remaining, because we do have from 4:20, 4:25 to 4:35, and a little bit of wiggle room perhaps into the wrap up, that you yourself can engage them in a larger team, a larger debrief with the entire the entire group in the room. So not a lecture.
I'll just add to that, because sometimes despite our best efforts, there's complete silence in the room and everybody's done.
Yeah, they're right.
Like, what the heck happened here? So if you need to step in and do that large group debrief because you feel like they didn't really dig deep enough, this is an opportunity for you to use your best facilitation skills and just step up and use your voice. Yeah. And talking. Yeah.
So what we're offering for you is the Pearl Promoting Excellence in Reflective Learning in Simulation Framework. So Pearl stands for Reaction, Description, Analysis, and Summary. So you can, I mean, in your package, in your facilitator package, there's a bit more detail on each of them, but you can just in the large group, if you have the time and feel like it's needed, share, ask them, share how you're feeling now that the scenario is over. Have someone summarize the case, interview the case from a team-based perspective. Really again, focusing on those collaborative competencies rather than the details of his health condition. And then you do the analysis piece, exploring aspects of the interview that worked well and those that would manage differently, express what was going on through your mind at various times, and then some take-home messages that they can apply to any future IPE sessions that are planned for them in their curriculum and of course their future practice. Michelle.
And then we have the wrap up and evaluation. So this wrap up slide here also has a little bit more debriefing questions that Moni had mentioned, considering 6 competency domains. So how does everyone think they did, both individually and collectively? And then there's the 6 domains here. And then, so what did everybody learn with, from, and about one another? Could be another question as part of the debrief. And then the students will have created their mind map in their group. So they're more than welcome to take a picture of the mind map, and you as facilitators are more than welcome to take a picture as well if you want. And then can remind the teams that they'll meet again in January in person. And then at the end, you as facilitators, if you are able to bring back the folder with the attendance sheet that has the QR code, the completed observer simulation team debrief form, the facilitator guide, and any markers, pens, or paper that were used for the activity.
We do encourage the learners to take pictures of the stuff that because some of them have learning portfolios in their respective programs, and so it becomes sort of an artifact or evidence of the activity that they would explore in their learning portfolios. So that would work. And the learners, of course, they would ask, if they're taking pictures of people, they would ask permission. but taking a picture of the mind map, that's just an inanimate object.
And then for the evaluation, they will have a QR code on a sheet of paper that is in your facilitator guide. So if you're able at the end to share the survey link so the students can do it before they leave, because they leave, they probably won't do it, and they won't have the QR code, or they will choose not to do it. So if you can kindly remind them to do it before they leave, that would be really appreciated. It's a pretty short evaluation form. I think there's only 6 questions. One has a few sub questions within it, but it's not too long. So for the students, before they come to this activity, they will, for the requirements beforehand, they will have watched the module on role clarification. They would have some of the students may have completed this in a previous year, but to remind them to watch the role clarification again, which we will be sending them out a reminder. And then, as mentioned previously, they will have the fictional case of Alex Parker. So the students will be able to familiarize themselves with the case beforehand. And then they will also have roles and responsibilities documents that would have been previously circulated to most of the students, and then a couple optional additional resources there for the students that want to look into a few more things before the activity.
If I may interrupt, Michelle, because the case revolves around somebody who presents with a chronic cough. So we made a document, that item number 3, last year, but we made it previously and keep adding to it, what the different health professionals' perspective is on how they would address a chronic cough. So in this document, and you'll get a copy of it, on each page is a profession. It has links to our professional associations, our regulatory body, a brief statement on the scope of practice, and then what that profession would do in terms of somebody who presents with a chronic cough. And so it has more professions are represented in this document than are participating next Friday. But if they're curious what the role of an RT would be, they can look it up. They'll have it, for example. Mm-hmm. And then the whole hope is that they can see the similarities and the differences. It's not intended to be an all-inclusive list of what all of us would do with somebody who has a chronic cough, but at least gives people an idea of what the role of an occupational therapist would be if somebody presents with a chronic cough.
Mhm.
What would OT think about? And that document, we did not write it in isolation. We did it in partnership with all of our co-educators.
Mhm.
And then there are some additional resources there. You can see the Curavilla reference, which is about a chronic cough clinic. And then the next one is about tobacco and the role of health professionals in smoking cessation, a joint statement. So we're certainly trying to role model here how we can work together when it comes to chronic cough or smoking.
Mhm. And in
Sorry to
this
interrupt
case,
you, Michelle.
Oh, no, that's good. Thanks, Moni.
and in this case, their module, the sort of the pre-read on rule clarification, we're using for this year only. In the last year, we'll be using it for this group of learners because they're in their second year and they've already done our first year iteration. They're familiar with this particular module that was done not through the University of Saskatchewan Holstead, but it was done collaboratively. I'm pretty sure Moni knows more about across the nation. And so they have already looked at this module, and we're just reminding them to have another look at it. Versus, you might be hearing, we have an online module that we have created in partnership with the University of Toronto that our year one learners will all be participating in. And will have completed prior to really engaging in any IPE activities. But we want to keep it simple and not overburden or introduce a new one. And this module works quite well for rule clarification.
And then some additional facilitator resources that we will provide you. And again, I just want to take a moment that we're so grateful that you are being facilitators, because this event activity would not happen without you all. So thank you so much. And hopefully we'll be able to prepare you and make sure you feel very comfortable. But at any time, if you have any questions after this, just email us and we'll be able to answer. But we will be providing you with the script of the standardized client or actor, Alex Parker. So you will have exactly what Alex Parker will have, a facilitator guide with more details, and then a simulation, some extra resources here. Again, they're not all required, but if you want to, you're able to read them. But we will have all this in your facilitator as additional resources. And then when you do come the day of the activity, you will pick up a package which will have the attendance QR code and the other forms and necessary items for the actual activity itself.
Mm-hmm. You actually do have the facilitator guide now because we put it in the invitation. So if you open up that, or if you can't, then let us know, because you will have the facilitator guide in there.
And then we can open the floor to any questions or need clarification on anything if you want us to review something again.
I will also add that at the top of your facilitator guide, there are 2 cell phone numbers, one for Catherine, one for Michelle. If something befalls you on Friday, September 13th, please let us know as soon as possible. Because we have doubled up facilitators in some of the rooms, that actually gives us a little bit of wiggle room. So Jillian and Minka, you might potentially be last minute facilitators on your own in a room if somebody is sick. So we do have at least that bit of a wiggle room.
And I will just mention, sometimes my phone kicks in and out of service. So if it goes straight to voicemail the first time, just try a second time and it won't. Or you could just text me too if that's easier, if it goes to voicemail.
I just have
Yes.
a question. Sorry. I can't seem to raise my hand on here anymore. I don't know this new format for Zoom. But my question is, do the students have their material already, or is that going to be sent to them?
The students
That's an
will
excellent question. Sorry, Laura, you're going to answer? You answer then. Oh.
The students will be receiving an email or a post on their learning platform today regarding all the activities that they need to
Actually,
prepare.
because we don't have a learning platform with them enrolled anymore, Laura, I think that we might send all of the course coordinators or IPE facilitators an email and have you forward it to all the students.
Mhm.
So we have that email drafted and ready to go today. So Becky, in your case, we will send you an email and ask you to forward it to all the second year physio students, for example.
Yeah, for me, because the course coordinators have me as in their UM Learn course already as a limited instructor, I can post it in the UM Learn. So however you see fit, whether it should be a post in the physiotherapy course that you're teaching, or whether you send it as an email. But yeah, we just want to make sure that all the learners get it.
Tanya and Becky, I'll send you an email and ask whether you want to send them an email or if you want me to just post it in 7160. Or Becky, you could post it in PT 7160, for example.
Sandra.
Just a logistical question with the room set up. Are they going to be set up? Are the tables going to be arranged for the groups to come in? Or are they going to have, or am I going to have to go there and arrange the tables for groups prior to the session?
Right.
That is an excellent question, Sandra. I think well, let me do that no, not me. I'm on sabbatical. Becky or Sandra Bichevel, between us, we'll figure it out. We'll put in let's put in a request to the room people in course and ask them to set up those rooms.
Okay.
So those would be for
yeah.
the rooms in rehab, but these rooms are fixed theaters. So
Yeah, Theater E and the 2 Apotex rooms, you can't reconfigure the room.
but
It's just those
certainly
rehab rooms.
And certainly, I think, Michelle, you and I in our rooms, Moni in your room, we can maybe put something to say this is one group, this is, so we spread them around. And for sure, when we're in these rooms, we will tell the students to sit in clumps rather than a long row. Their team should not be sitting in a long row.
And I can't remember, is R060 being used? Because that's not a course room. So we have to go through community health sciences, somebody's tech to get that room set up. But
Catherine, can you respond to that one?
Hi, Sandra. Yes, I've booked all the rooms. I can't remember which room is for which activity, but I can check on that for you. And I do have your email, which talks about getting in touch with CHS for that.
Yeah. Okay.
R060.
The set R060 does look like it is booked.
So then Sandra raises a good question. We need to ask physical plant to reconfigure that room. But so ideally, if everybody could go to their rooms relatively early and make sure that the room is set up the way you wish it to be set up, we'll try our best, but we might need your help in that.
I'm just thinking too that because it starts at 3, like the rehab rooms might already be in use from 1 to 3 for a lecture. So we'll have a really tight turnaround time to get those rooms set up. So, and I know that our course classroom tech can't be in 3 rooms at one time. So could be a bit of a challenge.
Perhaps, yeah, or maybe then if there's another session in the room between 1 and 3, maybe that lecture could be done in table format as well, in small group format.
Yeah.
That they won't mind having it non-lecture style, non-theater style for 1 to 3 p.m. That's a good point.
Mm-hmm.
We have a policy in dentistry for any of our rooms that the lectures are 50 minutes. So there's always 10 minutes for the next prep. You're not walking.
Yes, but 10 minutes to reconfigure a room is quite tight.
But I hope you're not going to be in the room till 3. We know one room, and that's the room I'm assigned to. Will be, but I'll be okay. Minka.
So just logistics, I guess, for the future recruitment. I have to say I'm a little distressed that I have to be there to pick up materials, and recognizing Laura should be in my room, but I'm booked from 2 to 3, which I recognize is tight. Like I need travel time. So I guess I would make a plea that if that's actually the time, both from a room booking and for us in our schedules, to actually block the time that I need to make available. And I would include the optional time, like, I would like to attend the facilitator debrief, but it's it's an extra 2 hours of time commitment. I just need to plan for it. And so, I'll make it work. I'll probably have my meeting in Apotex 50, but it would also, but for me to recruit, I need that kind of full windows for people to understand what their time commitment is. And then my other request is, you mentioned sending us the script. We have the facilitator guide. Will that be put on the invite for the 13th so that's easy for us to find?
Is that where you would like it?
It works for me. I find email hard to search, but
But you know what? It's very
whatever
easy
the
for us to do
typical.
both. We can do
Okay.
both. We can post, and Catherine, so you could help with that if you don't mind, that when has everybody received an invitation in their calendars for September 13th yet? Maybe not. Okay, so if Catherine, if you can send all the facilitators an invitation through their calendars for September 13th, we'll make it clear what needs to be attached to that. We'll give you a list, and then maybe actually you can put the room numbers that everybody's been assigned to within the body, within the description of the event as well, so people can see right away at a glance where they're supposed to go. And yes, if there's anybody who can't pick up their materials, just let us know and we'll help you out.
Mhm. And Minka, I'll pick it up. So no worries there. But thank you for that suggestion.
Maybe this is a dumb question, but where are we picking the materials up from?
Apotex 050, and it's actually in the top of the facilitator guide
Okay, thank you.
where you
Yeah.
pick it up.
Okay, I didn't
Yeah.
see that.
Yeah,
Yeah.
but just shoot us an email or a text if you need help picking up your materials. And we normally, like in the past, we had all the materials waiting for you in the room, but we thought this way it's a chance for people to see each other possibly a few minutes beforehand. Yes. So. Catherine, can you stop the recording, please?